Sheetal.
Thank you, sir. Good evening, everyone. So today I'll be talking about the Hoya Impress enhanced monofocal lens and my experience with this particular lens, which now I have been using since almost the past 1 year. So as we have realized the importance of functional intermediate vision, we have also realized that the regular standard monofocal lenses are not enough and we need something more, basically a lens that provides us a little wider range of focus to enable us to do activities at intermediate distance. So I'm very glad to share the success story of one of my patients whom I recently operated with the Hoya Vivinex Impress enhanced monofocal lens in both her eyes. She is a 63-year-old female. She is a principal of a secondary school, also a social activist by profession, and a palmist by hobby. So on presentation, slit lamp examination showed in the right eye nucleus sclerosis grade 2 cataract, and in the left eye she presented with a mature cataract with vision of just hand movements, and in the right eye she had vision of 6/12. Basically she was managing all her activities only with the right eye and had a lot of challenges which she will share in the video that I'll be showing at the end of the case. So the visual needs of this patient were identified and the goals of the surgery were essentially to provide her with functional intermediate vision without any compromise in the quality of vision, so that she is able to see her laptop, mobile, and is also able to sign documents which she had to do being the principal of the school. So I decided to use the Hoya Vivinex Impress enhanced monofocal lens, and this is the biometry sheet of this patient. She has a minimal cylinder of 0.63 diopters in the right eye and 0.68 diopters in the left eye. So this suited for this lens. And also you can see that in the biometry she has a IOL power of plus 23 diopters. So I kind of targeted it for emetropia in both the eyes. So it was plus 23. And this is the surgical video of the left eye, which was recently operated just 5 days ago. And I start my surgery by making a temporal 2.8 millimeter incision, and then injecting some amount of Xylocard and viscoelastic. So as it has already been emphasized many times that we want to have a well-centered capsulorhexis of between 5 to 5.5 millimeters to ensure proper positioning and centration of the lens in the post-op period. So with the Vivinex Impress enhanced monofocal lens, basically these lenses have an optimized spheric surface of the optic, due to which this lens is tolerant to some amount of decentration as well as tilt. So a decentration of up to 0.7 mm and a tilt of up to 5 degrees can be well tolerated. So I feel that this lens is good for those cases where you expect weakness in the zonules, like pseudo-exfoliation, or some amount of zonular weakness due to some other reason. So this is the phaco part. I'm using here the Centurion active fluidic system for phaco emulsification. I've already chopped the nucleus into 2 halves and also done my sub chops to divide the nucleus into 4 to 5 fragments. So this is a relatively soft cataract of grade 2, so easy to separate as well. And this system actually gives us very good chamber stability, very good followability because of the active fluidics. So I'm again chopping these fragments. So very important point for beginners in phaco, try to be in the safe zone, which is the central zone within the capsulorhexis margin. And this is the last piece being emulsified, the last fragment. And you can see that the chamber is very stable, there is no shallowing. So the phaco emulsification part is done. I like to use a coaxial irrigation aspiration system for IA and cortical cleanup. And for the PC polishing, I like to use the hydro polish method. I use a 26 gauge needle and basically a cannula to wash out the visco, the thin fibers which are sticking on the PC. So now I'm using the multi-cert injector from Hoya. My previous speakers have already emphasized on the advantages and benefits of this, and I'm also truly a fan of this injector system. You can see how easy it is to implant the lens, and it does not cause any kind of wound distortion or any kind of problems with the injection of the lens. And the lens goes in a very predictable and smooth manner into the capsular bag without any jerks or any optic or haptic adhesions. So you can see the lens is well centered in the capsular bag. And now I'm evacuating the viscoelastic from behind the IOL as well as in front of the IOL. Now, basically, how this lens helps to achieve enhanced depth of focus is essentially through a proprietary technology, which is incorporated in the central 2 millimeter zone on the optic. So, basically, in this zone, they have done a refractive modification, wherein there are microcurvatural changes that lead to changes in the power and variation in the power. So, as the incident light hits these tiny peaks and valleys, the light is basically converged in such a manner that it gives you an enhanced depth of focus. So because of this enhanced depth of focus, it also is forgiving to some amount of post-operative refractive surprises as well. So you can see that the lens surface is also very smooth. You cannot appreciate any impression, even an impression of the refractive zone which is there in the center, and it just looks like a regular monofocal lens. And the patients have never complained of any dysphotopsia or any kind of problem with their vision. So this is the post-op day 5 outcomes. Uncorrected patient was 6/6 partial in each eye and was accepting a slight cylinder 0.5 in both the eyes, improving to 6/6. And this is something that I'm seeing very consistently. The near add is for this patient is 1.5, and most of the times in 80% patient it is 1.5. So normally we see it's usually 2.5 or 2.75, but here because it reduces the need for this add, so actually you can assume that it is actually giving you about 1 diopter of additional depth. So this is just, I wanted to show the video, please. Yeah. So this is the patient's experience in her own words, please. It's very fine. Okay. Yeah. Ma'am, let us know something about your lifestyle. What are the kind of activities you like doing on your day-to-day basis?
Ma'am, you see, at the age of 63 years, I am running my own institution, my own school.
Wow.
It is up to 10th level. And besides this, I'm the active member of Womanira and Child Welfare Association. That's why I'm too much social also.
Very nice.
Yes, before my cataract surgery, there are many challenges in my life. I couldn't recognize the people's face, and they just look like a statue for me. And even I didn't call them their proper name, so I feel embarrassed. Climbing the stairs, it is great difficulty for me. I would afraid I could fall down from the stairs. DHLENCTPALO.
Very good.
This is DNHOBUC.
You're seeing full, okay, with both the eyes. That's 6/6 normal.
Thank you.
Start from this line, ma'am.
Ma'am, HVORK NDVKO BHO BZ.
Amazing. amazing. So that is actually 0.1 logmar. Wow.
Okay.
Can you
thank
read these lines, ma'am?
Thank you.
Just 1 minute, sir. Can you see anything in this line?
Yes, ma'am. Easily I can read.
Easily. These are very small letters actually.
There is no problem for me, ma'am.
Yeah.
Their parents should take them to parties and other social functions.
Wow. So this is the normal newspaper and magazine print.
Thank you, ma'am.
N8, which you are easily able to read.
Yes, ma'am. Now
So
visually.
you will actually not need reading glasses all the time. Anything here possible?
Okay, Sheetal,
Yes,
I think
ma'am.
Yeah, so the patient was very comfortable for here also. Normally we see the patients are able to see N8, but this patient was able to see N6 probably because she ended up having a slight 0.5 cylinder, and she was highly satisfied with the result, and I am seeing these results very consistently, and this is why when you see these results very repeatedly and consistently, this builds confidence in you as a surgeon, and you can advise these lenses with full confidence to your patients. And this is my experience about these lenses. So thank you so much for your kind attention.
Thank you, Sheetal. I think point well taken. All these newer lenses have given us a new life for thinking for us also and giving back to patient the best outcome possible. I think we would like to thank